Okay, hello everyone and welcome back. Now we will dive into the strategic discussions on advocates and the EU pediatric procurement policies. This session will be moderated by Rosanna Alessandro, Value-Based Procurement Director at Aquas, and we are honored to have a distinguished panel of experts joining us today. So, Rosanna, the floor is yours. Thank you.
Thank you. Thank you very much for inviting me to be here today. I'm Rosanna Alessandrello, the Value-Based Procurement Director of Aquas. Aquas is an agency of the Department of Health in Catalonia. And we are here today with Arnau Valls, the Head of Innovation at Hospital Sant Joan de Déu and ADD4KIDS Europe Director. Marek Migdal, the CEO of the Children Memorial Health Institute at Warsaw, Poland. Mark van der Bulke, Head of Belgian Cancer Center Cienciano, Brussels, here in Belgium. And Maria Sanchez, Senior Open Innovation Innovative Procurement Manager at the Health Headquarters, Munich. Okay, I'm sitting here. It's... Can you hear me? Yes. No? Yes, works. Great. Thank you. I was listening my voice there, but here no. Okay, very good. Very nice to have you here. All of you have been a representing member, beneficiary of ADD4KIDS project. And for me, this is a very interesting panel because not only you represent beneficiary of the ADD4KIDS, so promoter somehow this initiative, entities that were willing not to have this initiative in place, but also because we have a mix of panelists here, because we have clearly some of you represent hospitals, represent healthcare providers. In this case, we have Marek and Arnau, no, that represent each of you two different hospitals in different countries. We have also Mark that represent also the demand somehow in more specialized in this case in cancer, but with more in a health system perspective. And then we have AT Health that is a major player, no, right now in how to shape innovation across Europe. And so you are a major ecosystem. Behind you there are different kind of stakeholders in healthcare, in a health system, and so. Your experience in ADD4KIDS for sure has been different with this different perspective, with the different glasses you wear. And so the very first question that I have to each of you, and maybe you want to start, Marek, is asking you what was your experience to go through ADD4KIDS? Because ADD4KIDS, as was explained by Sofía first, then Anael, and then I don't know how, Norwen, sorry, I don't know how to pronounce your name. It's not that I don't know it, but the pronunciation is complex. Is that it's been somehow a travel, a journey across two different worlds. The world of pediatrics and the world of demand-driven innovation instruments. And this, the journey has been the very first period more internal, analyze the challenge of pediatrics and analyze the challenges of and the benefits also of demand-driven innovation instruments. The second one is been to talk with the rest of the Europe or rest of entities across Europe about these two words, and so having these working groups, these three events. And then the last one has been to put together the action plan based on the experience of the first moments. So this has been like a travel, a journey. So Marek, what was your experience during this journey?
Okay, let's start with the first impression. The journey was too fast, The 1 year is not enough to really work on this very specific topic, especially for people like me. I am a pediatrician with the expertise in the pediatric intensive care. And since 2018, I am the CEO of the Children's Memorial Health Institute, which is the biggest tertiary pediatric hospital, standalone pediatric hospital, but also the only one research institute dedicated only to pediatrics in Poland. So, and of course, now my perspective is completely different from the previous, my clinical life. And I learned a lot. I learned a lot also very simple things like terminology. Terminology and some tools which we are using, but in our daily practice, but using the different terminology. We're talking about the public tenders. We are talking about the kind of the we are the public hospital, so we are fully paid by our National Health Fund, which is a funding body. And it's extremely difficult for us to introduce innovations, different innovations, medical devices, medical technologies, into the clinical practice, because as you know, our national health funds in our countries, they are looking always for the reports from the cost effectiveness coming from the health technology assessment. And you know, with the innovations, we have no real solid data to support this innovation. Of course, we still I am rather a physician, not a manager of the hospital, so I like very much to, if there's any publication about the new mode of the treatment, I would like to test also. But it's extremely difficult to get a reimbursement. And reimbursement for me after these 12 months of our discussion is kind of the procurement, because we must get a public money to finance this our daily activities. So, as I said, it was extremely interesting experience. It's very sad that it's the end, but I don't. Maybe I should correct my last phrase. It's not the end. Maybe it's the beginning of the cooperation, because we get the same goal, regardless which institutions we represent. We must think about as it was said this morning, about the future of children, especially because this pediatric population in Europe is decreasing.
Yes.
Is decreasing in each of the European countries except France.
I'm from Belgium.
I know.
Okay, thank you very much, Marek. So fast, and I think that all of us, all of the ones that we are here, we can share this, and also we can share that the fact that maybe some of the it's the beginning, because we need to complete some of the tasks to achieve the impact we want to achieve, like how to make sure that then at the end we involve the HTA, we get the data to get the cost effectiveness, the reimbursement. So that's a very key point. Arnau.
Thank you. So I can resonate on most of the things that Marek said. For us, it's been also a fast project, but also very needed. And I think we've realized that most at the end of it on how much we've learned from the beginning. Because on the beginning, we thought that we knew something about public procurement innovation. We are a private non-for-profit focused in pediatric and maternity health. And we had the experience of going through a public procurement innovation project in diabetes. Yes. That was a success. We were very happy together, and thanks to the help of Aquas on all this process. But we not until the point that we started the project realized that the procurement systems and the adoption methodologies and tools that exist go way beyond the one that we knew, that there's many things that we still needed to learn, and how complex it is. So we knew the complexity of it in our own experience through our diabetes project. But we didn't know about the opportunities that this brings and how much we needed to learn and to adapt as an institution also to really adopt this, right? And the only thing that we had clear at the beginning is that a new mechanism or something needed to change, or at least to become all of us more familiar with these mechanisms, because as said before by Nowen, we invest a lot of money, efforts in innovation from research. It's a long path, but if it didn't get adopted at the end, all these efforts are lost. And the reality of the numbers today is that less than 25% of the innovations that we do arrive finally to the patient. So we need this kind of projects to really, and this kind of programs to really make the solutions arrive. And I think that in pediatric and rare diseases, it's even more important. And having tests in this vulnerable population, having programs and tools like the social impact bonds that have a co-sharing of the risk, co-investments, and are key solutions that can help improve those numbers of the arrival of solutions into the market in pediatrics and rare disease, and then maybe can be extended to other populations.
Thank you very much, Arnaud. Very interesting. So it's very interesting apart from fast now learning. So that's an interesting word, because really for all these collaborative projects, now the learning is, I think, the most well, at least in personal point of view, one of the most relevant asset, and also really interesting that is an opportunity. No, that now it's opening to an opportunity on how maybe to focus on how to all this research investment that we do in research can one day arrive to our patients. Very interesting. Thank you, Mark.
Yeah, I'm still trying to get into the head of the healthcare system because Cienzano is part of the healthcare system, but we're normally not the driver. But I think, indeed, a one-year project is very short. So you cannot expect really to make a lot of difference, but ADD4KIDS did it. That is something that is very, very important. You see, and especially for, if I look at the federal healthcare support in Belgium, we don't really have procurement, PPIs, PCPs. That is not in the federal healthcare system. So it's something that we would like to consider, and I think participating at such projects can help to see how we can do it. And we just had a discussion. Aquas apparently emerged from an health technology body and added innovation. We have a health technology body in Belgium. Maybe we should discuss now with them and see to include a pillar, especially because they are closely linked to Cienzano. We could build that together. Now, for us, as Cienzano, we were a little bit already aware about what procurement was because we have a big project together on a PCP, which we will come back to, where, of course, you start learning what is it about. The PPI is now coming, and that's going to be very interesting because that's also something you can start in different steps and build on the different elements, and that makes, and if I look now, because you say the community gets smaller, but these kind of projects tighten up the community. And you can enlarge that, because one of the things that we discussed already with Helene a lot, you have these large initiatives at the EBCP level where you bring the big hospitals together. We should not forget the pediatrics, because they are not always in the big hospitals, but associated. So we have to find definitely, because that is a difference that we had with the previous one. Pediatrics is talking about relatively low incidence. It's a smaller group. So it's more difficult to incentivize the industry to work on that, to give attention to that. So you should try to build on something that the market is maybe a little bit bigger. And then another thing that is the demand-driven tools is one thing, but you should also look at the need. The need should be matching the demand. So we're going to go through that in Belgium. We have now a need-driven, let's say, concept. It's still in work in progress, but the demands will should follow the needs, not, I think, the pull and push. We have to see, we have to balance it. There has to be, of course, interest for the industry, otherwise we will not get anything. But that's what I think it was a very fruitful learning.
Very good. Thank you very much. So fruitful learning, and already with some ideas on also maybe support. Why not? Who know? In Poland, this idea of merging HTA with public procurement innovation all together, and maybe this could be a way not to give an answer to different countries, and very very relevant. I think that we tied the community thanks to this project in different ways, and from the demand for sure. So this can also help to increase the incidence in the end. Thank you. And Maria.
Okay, so for me, I will say other words. For me, it's been intense.
Intense.
Intense because it's been a very deep effort because we had a big challenge and a very important goal. And we had the opportunity, and I think I would like to thank also the European Commission to select a European action plan on pediatrics, because at least it's the first moment to really activate this part and for them to put over the table that there is a need to have an action plan and to work together. And I say intense because the need is completely cross-border. And this is what is difficult. It's much easier to do something at member state level, leverage effort, understanding each other. But when you work cross-border, and this is the goal of my organization, is really complex to align incentives, initiatives, needs, challenges. But for kids, for pediatric, this is essential. It's essential to really create a community across Europe, to increase the number of patients, and also really to create a market that is also attractive for innovators that develop solutions in innovation. And here I'm very excited also to see how all the pieces are coming together, and we saw in the nice presentation that Nolwenn did that there is the moment now in Europe to do so. So we have a system to share data, we have, that is the European health data space that we needed, or is increasing, but we also are looking for a single market to be more competitive. And I think pediatric, it could be the perfect example. And in difference with other countries leading innovation in other topics, I think Europe could be the leader for pediatric innovation. And I think for me it's very exciting. We have to go far. So if we want to go far, we need to go together, and it's very aligned with this objective in my organization that is bringing all different stakeholders together. And also, as it's already been mentioned, that innovation needs to reach the patient and needs to be adopted. Otherwise, it's too long, it's too complex, it's too costly, that if it doesn't really reach the patient, it really doesn't make sense. But also needs to go a little bit fast, and I'm sorry it was fast, the project, but we did it. But because the children, they grow and they become adults, and there is a need today. And we need to really leverage of efforts to also be a bit faster and to get to the speed with innovators. Sometimes innovators are telling us, you need to go a bit faster, and otherwise we die in the process. Okay, so I think this is the.
Okay, it looks learning. Like I find intense. No, now with the fast, I was thinking about cars, not the cartoon.
Yes.
By the way, it was intense, deep effort, and by the way, you are highlighting also very, very relevant topic, Maria. That is that somehow who supported us to initiate all this work has been the European Commission, thanks to the funds that we have received, and the fact also that it is the moment to do so now, because also thanks to the presentation of Nolwenn, we could see also there are several strategies now and several initiatives now that we could leverage on. So that's really also a very opportunistic moment. So that's it's like let's do it, and let's not somehow lose the train, and make it happen. Okay, thank you very much. And now I would like to ask before to Mark, and then we go three, and then you last. So, do you feel that this experience could be somehow thinking about a post ADD4KIDS? And I'm not talking about what we're going to do after ADD4KIDS. I'm talking more generically. Taking in consideration the experience that you have gone through, do you think that experience like this is relevant for other entities like similar to you, or also for your health system, in a way that then you could maybe share this experience, share this knowledge with these entities, and making sure that this can be somehow, it's not just something that you lived by your own, but it can be shared, and this knowledge, this learning can be leveraged on?
Yeah, well, I think the whole, the overall concept of procurement and the PCPs, the PPIs, and all the things that come around, also the interaction with EIT, is something that we are already bringing to other partners, because there's a limited understanding of in fact, many people do not know that the Commission, in this case the Commission, but also in the Member States, sometimes in the Member States agencies, the authorities have money, that you can make propositions and say to them, look, we need that, is there a way to build it? And then if you can set up a small community, you can start such a project. So that's something that people, honestly, when we started, I was not aware at all about what it was about. And then you learn, and I remember the discussions that we had with the other partners, because we were 5-6 countries together. Nobody understood that. And now you should see how interested people are and enthusiastic people are, because you see really it's people that are driven by research. So because the PCP is a research driven, but they get really interested because first of all you see innovation appearing, things that they never saw, that comes from the industry, and that they would not be able to do. And the second thing is that you see it gradually growing to something that you will be able to use yourself, and you have been contributing to that. So it's really something that I think people should foster much more, and we should stimulate that, because it has a lot of value. So I think that was the most important element that we learned of this thing, and definitely people are starting to get, once people are aware that this exists, people are starting to use it. And for example, in Belgium, it's not because at the federal level we don't have it, we have it at the regional level. And there it's very often used. And I'm talking about a big project with several millions, but you have smaller things also that you can develop. So it's something that once you understand the mechanism, and one thing that is really important, it should be also bottom up, much more than it should come top down. Some things will come top down, but if it goes bottom up, because that also convinces a little bit the industry, the suppliers, that there will be a market, because at the end somebody will and I think especially if we now talk about pediatrics, we should really pull together the European organizations, because then you have a market, and then you have to have an agreement, and there are bodies where you can start the discussions in. So
okay, thank you very much. So well, clearly makes sense, no, to foster a collaboration and have a bottom-up mechanism and working together, because if we stimulate it further, it can work, and you get engagement from the people that needs it. Arnau?
Yeah, so I would say that from the healthcare providers' perspectives, we are in a very specific situation. We are in the beginning and the end of the journey. So we are the ones that are using those technologies, but are also the ones that have the unmet needs and need these new technologies. And in pediatrics, where there's a clear gap and lack of technologies, that's even more evident. So traveling through this journey, it's not easy. I think that on top of what's been already said, I think that we must also be aware that with the new MDR, the complications on the process of regulation have been higher, and we are now noticing, at least in a regional level, that companies, industry that have to go through this process again and have to prioritize technologies, they deprioritize, so do not prioritize those that don't have a real return on investment. And that have put children's and pediatric projects even in a worse situation. So having a process that takes the innovator from the hand and helps from the beginning with a co-investment to de-risk all this process and align the incentives and the efforts from public and private entities and government to help navigate this process and make this process of bringing innovation into the market more efficient, I think it's key. It's key for us also, so for the innovators and for us. And that's why I think that these kind of programs are so important. First to that, second to align public and private collaborations to learn and know new tools, and I think we need more of that and continue with that action plan to a reality.
Very, very interesting dimension to the new MDR, and the fact that now the companies now need to prioritize. That's the technology to go through the new MDR. That's a really it could be an opportunity to ensure, an opportunity window to ensure that then we can introduce the innovation that we need for our patient in the moment. Very, very interesting point, and clearly an alignment for public and private. Thank you. Marek.
I would like to return back to the title of this roundtable, is the pediatric procurement policies related to innovations. And what is crucial that we get a very solid document, this white paper. White paper needs now a proper dissemination. We know from our clinical practice that clinicians, but also politicians, they must to get a time to change their mind. So I think there's a common goal for all of us involved in this project now to actively support this white paper. And also another white paper presented last year during the Pediatric Innovation Day in Riga, showing the differences between states and Europe. Now, as you know, I don't want to talk about the great politics, but we're saying that Europe must be more independent, must be more innovative in all of the fields of the economics, industry. So I think it's also a good time to say, let's be more innovative, using the procurement policies, using the regulatory issues. We know that there are a lot of the barriers. This very famous regulation on the medical devices is a nightmare.
Yeah.
We try to get one of the, we get together with colleagues from Italy and Austria, ORFADEF, which is one of the first in Europe project dedicated to the medical devices for children. We'll see after 3 years how we can work together and how we can collect the data for the further development for the industry. But as I said, we must be patient. It takes time to change our minds, but also the minds of the politicians. And I think we should think how to promote the results of our common work, the white paper, which is very important document. Maybe we can, of course, there are just, it was information that 15 European countries were involved, but so it's half of the member states. So we must to find the solution, how to properly disseminate this fantastic knowledge. A
Very
very good working document.
Very good. Thank you very much. I think that's clear that the fruits of this project, that are the white paper and also the action plan, both needs to be clearly disseminated in a proper way to all the levels, to the policymakers, and to boost this pediatric innovation adoption. Very nice. Thank you. And you, in your case, what are your 3 main lessons learned from this project?
Okay. So it's very related to what Marek was saying. So the first thing is there is a huge difference in maturity level, understanding, the use of the instruments. So there is a lot of work to do, and this is why it's part of the first actions. There is the building capacity, mainstreaming the power of procurement to drive innovation. And also this is very, very important because usually it's always thought that innovation should be done by innovators, which is true, but it is very, very important that innovators, SMEs, startups, understand there is a new way to enter in the market by combine and join forces with actual procurers, but also healthcare professionals, understanding from the very beginning what is the real unmet need and what is that they have to develop for. Because if not, they could be developing or leveraging the fact that they have a technology that they want to put a product out of there, but there is not a real need. So, and is, for me, I always talk there is working in the interface in between innovators and healthcare professionals. And here is where we need to find the support is needed. And this is why we want to also use in other projects, for example, HIPS, that we want also to support in here, but also with the capacity of the ecosystem that we have. Because there is a need, and this is another lesson learned, of a lot of support. A lot of support, collaboration, public-private collaboration, bringing new stakeholders, convincing investors, convincing other sources of funding, internal funding, but external funding, and then mainstreaming, the use. But this is probably is not for everyone in the very beginning. Maybe some strong leaders or innovators in pediatric hospitals could start this process, and then others will join. And this is why we are thinking in this European Action Plan, starting from a nucleus, from very motivated and well-convinced group of people, but also populating and disseminating across Europe for others to come on board once they see that there is use cases, that they can do it, how they can do it, and also maybe using examples done. Here we can revert the fact that we can use like examples or use cases from the use of the instrument in adults to the use of the instrument in pediatrics, but not designed for adults and incorporated in pediatrics, but the use of the instrument, as for example, OncoNGS, that was a PCP, we don't need to rework in that. Maybe we can adapt it to pediatrics in the gene panel, but we don't need to develop the whole process. So these kind of ideas could fast track the use and mainstream the use of the instruments, and also is validated by the industry and the market that they can develop for children, and there is a need. So I think these are the lessons learned and the main takeaways from this collaboration.
Very good, very interesting. So interesting what you mentioned, not only the maturity level, I really like it, not only the maturity level of how we understand on the instrument, but also from the market point of view, how the new ways that they can enter in the market, because at the end, innovation is also a way to enter. It's also it's not just in technology. So that's a very interesting point. Then the need of a lot of support, that's clear. That is shared by everybody. And then how then we can leverage with the experience we already have maybe in adults to ensure that then finally we can get the appropriate instruments for pediatric. Thank you very much. And then to each of you, and maybe this time we start from around. What about the next? Now we have an action plan, we have a white paper, we have an action plan, and now tomorrow, what is going to happen in San Joan de Deo and in ADD4KIDS?
Good. So I think we've been really involved in all this year in trying to understand all these processes. Now I think it's time for implementation. It's time to get action. And I would summarize our implications in maybe three main actions. First would be outreach and awareness. The second would be to scale up the innovation through cross-hospital challenging programs. And the third would be on KPIs. How do we evaluate the impact of all this to really see if that's making an impact? And to be more concrete on outreach and awareness, we are coordinating the ADD4KIDS initiative, a European hub for innovation with most of the colleagues that also are part of ADD4KIDS. And we established in 2020 one day dedicated to innovations, to gather all public procurers, policymakers, hospitals, all stakeholders in one day in which we can discuss and bring together our knowledge to make an impact in innovation. So the first thing is that this year we will have at the 20th of November, the Paediatric Innovation Day. It's going to be held in Barcelona. So previous year was in Warsaw, a very nice event.
No, 2 years ago.
2 years ago.
Last year in Riga.
Riga. And this year it's going to be in Barcelona, so you are all invited on the 20th of November. In there we will feature some topics on adoption and try to bring some real examples or try to make that part of the Innovation Day. The second thing on scaling up the cross-hospital collaboration, so we have a needs-led program at a regional and local level that focuses in identifying unmet needs that we have in our hospital and try to collaborate with industry to find solutions to those unmet needs. So a challenge-based program. But when we share those with other hospitals, we find that in pediatrics, not only in Europe, but around the world, we have very similar challenges. So we hope to continue with those programs in a cross-border way to help on this demand-driven approach. And the last one, in terms of KPIs, I think we should start to bring into the evaluation of the readiness of our technologies through all this journey that I was explaining at the beginning, from the unmet need to the market, the adoption readiness level of our technologies. Because if you put that there and you put a number on there and you measure it, then it's easier to then know how is it evolving, how is it implemented. So we hope that we can also, as the technology readiness level, we can integrate the adoption readiness level in our innovations.
Okay, thank you. So very interesting. So we have the outreach and awareness, the scale up cross borders, the evaluation, and all of us will be the 20th of November in Barcelona.
Great.
The ADD4KIDS event.
All invited.
Thank you very much. Marek.
Again, some comments on what previous speakers said. First of all, I think that we must remember the role of the patients and families. If you are talking about the needs, we must listen this group, very important group. Also nurses in the hospital. Nurses are also quite frequently innovators because they are practitioners. So, and still at least in Poland, we get still a model that we are rather at the stage of the PCP because we are using the money from charity or from the research to introduce innovations to collect the data. I will tell you just one example. 2 years ago, we received from one of the charity foundation the device for the laser thermoablation, which is used for the deeply seated tumors or also for the treatment of the drug-resistant epilepsy. This is less invasive as classical neurosurgery. And the problem is it was not the problem, the cost of the equipment. We get the staff, we receive the equipment. The problem is the using materials. The one catheter costs 10,000 euros, and we do 30, 40 such interventions a year. So we apply for the research project. We receive 5 million euros for 5 years for the staff and also for the purchasing of the equipment. And our goal is to collect the data, which will be later presented to our National Health Assessment Technology Agency and to the Ministry of Health to include this type of the procedure for the list of the reimbursement procedures. So that's what I said previously. We must sometimes be patient. We must to get a time and go slowly, step by step, to change, in fact, using the innovative techniques, our clinical daily life. That's our goal, and that's what we do on our daily practice. And as I said, quite often we decrease the role of the nurses. Nurses are extremely important for, I spent 35 years in the pediatric intensive care unit, and we can't work alone without nurses, so, and other specialists. So it's a multi-disciplinary approach. It's something which is extremely important if you are talking about the innovations.
Okay, thank you very much, Marek. So the important thing is, from tomorrow, now what you're going to do is work in a multidisciplinary way, including nurses for sure. That's a key component. Patients first, but nurses as well. But you're adding also on top of all of this one interesting idea, no? That a way to, at the end, once we do a pre-commercial procurement or innovation procurement, then we should get some research funds to ensure that we can gather the data to go to the HTA agency. So now the question is maybe, and this is a question that I can do to everyone, to the full audience, is how far we could include this collection of data in this kind of contract, and they could be somehow already designed in a way that also the company takes the risk because we are collecting still the data from them. So, but by the way, it's a question that is it's an open. Maybe we are not going to answer now, but because we try to design this kind of contract, and it is not always easy. So it's just something that maybe we should explore after ADD4KIDS in a post project. Mark.
Well, I was also thinking that what Marek says, we should include children and parents and indeed the nurses. It's a very important element. The other thing is that there is also a flow from pediatrics to IA to adults. So this bridging we should also make, because it's of different professionals. And I hear from many things that these are also in silos with different discussions. So I think that's also something that we should try to bridge. And then I heard especially the regulation. So one concept that I really think we should build for pediatrics is a regulatory sandbox. An approach where you bring in all the topics that you need, because we were doing it for other things. Why not think on a sandbox really for pediatrics and make it a European one that everybody can join, because it's a small community. It's on average 30,000 new cases a year in Europe, a bit like that. I'm not 100%. I'm looking at you or maybe Helene knows exactly the number, how many cases. So it's not a big group. So I think we should think about that, because then we will learn from each other to bring it forward. And the other thing is, we should make a cluster. In the EBCP, there are plenty of projects that deal on pediatrics. We should bring them together. And that is something I think we could take on the lead on that and work together. and put all this, because there is first of all the year ends. There's an year end on a pediatric. We have Jane. We have working groups in Jane on. So UNEDCC is talking about pediatrics in our upcoming joint action on personalized medicine pediatrics, and there are plenty of other projects. We should now cluster them, and then see what is the next step and link it to your action plan. And because what you don't see in these actions is procurement, because that they don't know about.
Exactly.
So if we can bridge it, so that I think is something that we could, and you can even ask it to the Commission to stimulate it, because that is a small project for them, and just and then you have something that I think, and you mentioned OncoNGS. Indeed, OncoNGS, which is a diagnostic platform on liquid biopsy, so it's non-invasive. It's now built for adults. It could be retaught to pediatric, even to AYA also, and in a continuous way. So I think that is definitely something that we are open to discuss. And we have two very nice solutions, very disrupting sometimes, but that could be an option to do.
And important, that is cheap, affordable, and accessible. And innovation shouldn't create inequalities. And here is very important, this approach, that every solution that you create in innovation really doesn't create inequalities. So for that, it needs to be affordable. It cannot be a super complex solution. Should be like accessible for the system.
Okay, so interesting inputs from Mark regarding, for instance, I imagine the regulatory sandbox for pediatrics. You were thinking about with the numbers about specifically cancer and leukemia, most probably, yes. So that's interesting.
But
we can extend to other, exactly, and then make a cross. Instead of having all these projects that we are working on, European projects where there are already some aspect from pediatrics relating with cancer in this case, making sure that we make all together and we join all together in post ADD4KIDS initiatives and then OncoNGS specifically for pediatrics. So this could be a post OncoNGS or a public procurement of innovation.
Yeah, and it's called now OncoNGS, but it's in fact a large NGS panel, and we could do that broader than just cancer. That's not the point.
Yes,
it's the principle of working. It will demand probably new suppliers, new players, but that is not limited. It's the principle that is.
That's an interesting idea. Very good. Thank you very much. And Maria, tomorrow, what are you going to do?
Okay, so tomorrow I'm going to rest. No, but what we are going to do is continue doing what we do now in EIT Health, is being a support entity cross-border and probably support this specific community that we are very engaged. We are non-profit and NGO, so I think we should support innovation in the angle that some others maybe cannot support. So creating or opening the space for specific programs in this open innovation program where we bring the industry also to support in the innovation pathway together with the healthcare providers, but also innovators. We will, of course, integrate pediatrics on whatever comes out from this European Action Plan into our HIPS project, but also we are here to support any of the initiatives to continue and disseminate the European Action Plan, but also maybe trying to create use cases in Poland, leveraging this investment in public procurement and supporting from the healthcare approach, and especially if we can create a use case in pediatrics cross-border. We can also support, and we want to support ADD4KIDS and different activities into the innovation adoption, also OncoNGS and any other opportunities. So we are like supporting entities trying to bring other players in the ecosystem. We have the Venture Center of Excellence with different type of investors. So we are already activating the conversations into bringing them close to invest in pediatrics and making attractive for them.
Very good. So we are talking about open innovation project programs. We're talking about HIPS, a co-funded project from European Commission about public procurement of innovation. We're talking about dissemination of the action plan, supporting use cases in pediatrics, supporting ADD4KIDS, venture capitalists. So everything.
Everything we can.
Thank you very much for this nice round table. Thanks to all of you for being here. Thank you.
Thank you.
See?
We have to go down.
Yes. No.
Thank you, Rosanna, and thank you to all the panelists for this great and insightful discussion. Now we will open a moment for questions that you may have, and for all the presentations that you have seen. Here we have Patricia with the mic. So if everyone, the gentleman in the back. Marek, I think the gentleman in the back have a question for you.
Should play their role to implement this action plan. My question is how City Council, like City Council of Barcelona, City Council of Brussels, can play their role to implement this question. And my next question is also for Madam Maria, that she was saying that we need more stakeholder to bring in. I don't understand who those are stakeholders that we need to bring in to implement this action plan. Thank you.
You want me to start, or you want to
I
start?
can. So answering for your question, it depends on the model of the healthcare. In some countries, there's, as we just listening, the organization is on the regional level. In some countries, it's on a central level. In the case of Poland, it's central level. So it's for me, it's a real partner for all of the negotiations. It's the Minister of Health, because I report directly to the Ministry of Health, not to Mayor of Warsaw. And also, we get a central financing system, National Health Fund. They get some regional offices, but the decisions are coming from the headquarters. So it depends, and it's different situation in different EU member states.
So in my case, it's because I think the stakeholders engaged in terms of healthcare professionals or hospitals are more pediatric dedicated hospitals, where the pediatric department in generalistic hospitals sometimes are not as engaged into these procurement practices or not that involved in the innovation adoption part of pediatrics. There is also innovators that we need to understand why innovation is not being designed for pediatrics. So we need to talk with them and we need to understand what's going on. If they see the process very long, complex, costly, how we can stimulate the innovation from their side. And also others stakeholders that has been absent completely sometimes, no? Like some venture capitalists, even the investment branch of corporates. We need to talk with them and we need to make the point. So that's the idea.
Well, thanks for a great roundtable. I wanted to emphasize what Marek has said. I don't think, maybe I haven't heard the word that clearly or I've missed it, but it's important to bring the payers to the table. These are the guys who are going to tell us what exactly they need for them to have an easy decision to make at the end of the day. And probably it's not a matter of having them all, but having a few involved from different setups, different settings, and with different views. But certainly that is something that sometimes I miss when we gather the stakeholders. But I think we all agree that the guys who are going to put the money probably should have something to say at the end of the day. Yeah.
Thank you for your comment. It's working. But today is a beautiful day, so I don't want to be too bitter. At least in our country, the payers, that means the financing bodies, they are not looking for the innovations. Sometimes they treat these innovations as a kind of the medical experiments, and they are saying, no, come on, go to the medical research agency to get a fund, or to find the sponsors, the industry. So, but of course, I use many times today the word "be patient." There is a kind of the learning curve. We must to repeat our argues, to collect the data and to show with such innovations we can really achieve better results in terms of the not only improving the health but also the economic results. So this is a slow process. There is a very good, we as medical students, we are obliged to learn Latin. There is a very good phrase in Latin, repetitio mater studiorum est. So we must repeat, and finally maybe we can be successful on this long journey. Thank you.
I would like to add something about this discussion, because I think it's a very interesting discussion. In the example that we have in Catalonia, for instance, we got the payer already involved from the very beginning when we initiated the program of innovation procurement in Aquas, like 12 or 13 years ago. So, and then in 2017, they published the call of public procurement of innovation. In fact, the diabetes project comes from these programs. But this is not, it's true that it's not a wide example in all the regions across Europe. And I'm talking about regions because it's true that in Spain we have, like in Italy, we have that each region has its own department of health, while we have countries like France or Poland that they have national department of health. But still there are some examples of, I'm thinking about now NHS, England's NHS supply chain, where they do this kind of value-based procurement or innovation procurement, and in the contract somehow they are supporting the way through the contract this collection of data. So what I would like to suggest with this is that maybe the payer support is key, because also in NHS supply chain, at the end of the day, it's an entity of the Department of Health of UK, of England. But still, maybe they are not always putting additional funds. I mean, initially, maybe we can get support with, why not, maybe European Commission co-funded projects, or funds that the same industry maybe wants to take additional risk to make this happen. And this is something that little by little, if few use cases work, then can become a reality. But yes, be patient. Thank you very much.
I would like also to comment on what you already mentioned, Marek, that the patients are important, and I think that in the field of pediatrics, so it's the patient is also the families, so the parents and the relatives, and they are also very important as a payer because they are very good for fundraising, for dissemination, for advocacy also to the policymakers. And I think we don't have to underestimate the power they can have and facilitate the process to make. But then we have to explain them what it is, because we tried, for example, we tested in Belgium, and it's, yeah, they didn't really, it takes time to make explanation, and I think there is an important role of dissemination of that, of this type of tools, which are really important. A second point is what has been said earlier by Anaël, and it was also, he mentioned also the centralized governance of that, and I was wondering, hearing what after the round table, there is not one way to organize it in the different countries. There is constraint, there is organization, and isn't it better to have to create a network? It's we know that now Europe speak a lot about networks, but to try to create a network and with different ways to organize and to make it feasible. There is a need of different expertise, different specialties, different infrastructures, but this is organized differently in the different countries, so maybe to create a network as it has started with ECHOs, and you have ECHO and for Kids Europe, maybe to extend and to try to create a network on that. I don't know what you think about it, rather than governance.
I think that you summarize perfectly what we discussed today, and also what's the future. Still, there's a need for the networking, to exchange the knowledge, exchange the experiences, regardless of the different situation in different countries or different regions. So that's what is quite typical, not only for this type of the work, but also for our clinical daily work, to exchange the knowledge, to look for the new initiatives. So I fully support what you said. Thank you.
Thank you, everyone, for your questions and for keeping the debates alive. And now, to close this event, we'll have a closing message from our host today, Esther Borràs, delegate of the Government of Catalonia here in the EU. Please, Esther Borràs, join us.
I don't need pediatric care, but a senior care. So maybe in the future we can have another conversation together. So first of all, good afternoon, everyone. I just want to start by thanking you all for being here today at the delegation of the Catalan government here in Brussels. It has been a real pleasure to welcome you and to support such an important initiative. Seeing so many dedicated professionals working together on a project like ADD4KIDS, it's truly inspiring. That's why we are especially pleased to host Sant Joan de Déu Children's Hospital, Aquas, and the entire consortium. Your work highlights not only the strength of research and innovation in Catalonia, but also the importance of cross-border partnerships in tackling shared challenges. The project you have been working on brings together several key priorities: strengthening European collaboration through knowledge sharing, ensuring that innovation reaches patients who need it most, focusing on children's health as long-term investment in society, and using public procurement as a strategic tool to drive meaningful change. The past few years have reinforced how essential healthcare is in all aspects of our lives. Even though the European Union's role in health policy remains limited, there is huge potential in cooperation at the regional and national levels. This is why the government of Catalonia has long supported organizations like Aquas in their European engagement, particularly through networks such as Eureka, which bring together regional health authorities to exchange expertise and best practices. Innovation moves fast, and the healthcare sector is no exception. The challenge is not just developing new solutions, but making sure that are implemented effectively and equitably. One of the most important aspects of your project has been public procurement, a sometimes overlooked but incredibly powerful tool. Used strategically, it can drive innovation, bridge market gaps, and make sure public investment delivers real impact. As a government, one of our main goals is to provide spaces where Catalan institutions and their European partners can connect, exchange ideas, and create new opportunity together. This is exactly what today represents: building and strengthening partnerships, exploring ways to maximize European funding, and contributing to a more innovative and collaborative healthcare system. Your work is not just about policies or funding mechanism. You want to see my photo? I'm not important here. As I said, your work is not just about policies or funding mechanism, it's about making a real difference in people's life, and that is something truly meaningful. Once again, thank you for the dedication and expertise you have brought to this project. We look forward to following your progress. Sorry, I think I did something. We look forward to following your progress, hearing about the next steps in your action plan, and seeing the new initiatives that will emerge from this collaboration. The delegation will continue to support you in any way we can. I wish you all a pleasant journey home, and I hope to see you again. Thank you very much again.
Thank you, Esther, for your kind words and for the support of the delegation to the ADD4KIDS project. Yeah, maybe we can move this. No, you were not the only one. Don't worry. So I want to finish this with a great and big sincere thank you to all our speakers, panelists, and to all of you for being part of this conversation. This is how we achieve change and make real improvements through close collaboration and commitment to action. But the conversation doesn't stop here. I encourage you to stay connected with us through the social media platforms and also through our website, where we will continue to share the updates on the European Action Plan and the white paper. Thank you all again for being part of this project, and it has been an honor to guide you in this event. Thank you. And before leaving the room, I will ask to all the participants in the discussion and also the project to join me in the stage to have a group photo. You look great, so don't be shy.